The TIPS program brings seniors out of isolation, and they're here and they're meeting with each other. But then they're meeting with people that they've never met before. Even the person who is taking the vital statistics. I've always found them to be so kind.
When we began the TIPS program, it was truly a team effort. And our commissioner, May Carpenter, was at the helm. It was about 2013 that Jean Coppola and I were at a grant makers session. And at that time, we really had planned to talk to particular grant makers about this idea that we had. We had an opportunity to talk to a program officer from the Harry and Jeanette Weinberg Foundation. And as we were talking to him, we noticed his eyes lit up.
The TIPS program began in 2013, and it was started by a friend and colleague of mine, a woman named Jean Coppola, who was a professor at Pace. And Jean was always a real strong believer in having students go out into the community to do things. And Jean also had a real soft spot, I guess you'd call it, in her heart for working with seniors. Jean was teaching a class in New York City, and she engaged her students in thinking about how they could provide some kind of healthcare benefits to seniors.
TIPS is a short for the Telehealth Intervention Programs for Seniors. Growing up, my brother Chris and I were always involved with technology and thinking that how this could go into the next level and be scalable into society. We always had that background of technology was out there to enable remote needs so people would not have to travel far to go get the same kind of care. He said, why can't this be something where this could focus on also the well people who are living independently, living an active life.
We started off with kind of a grand idea from May Carpenter. We developed what was a brand new model for providing services like this. That what we had to do with the TIPS program is we had to design it, run it, evaluate it, sell it, and maintain it all at the same time. And the model turned out to be great.
We got together, sat down in a room, and began talking about what we could develop. We came up with the Telehealth Intervention Programs for Seniors. Commissioner May Carpenter is an amazing visionary. The TIPS program for her is nothing less than a ministry. She sees older adults as being jewels. So her understanding and appreciation for social justice is solid. And I believe that that really is the foundation for many of the programs that we offer here for seniors, particularly TIPS, because it's such an empowering program. And it certainly does give seniors a voice about their own health. I'll never forget when we were working as a team on the proposal. We were talking to one another night and day because we definitely wanted to be able to get this funding to begin this program. So we would talk to one another at 2 o'clock in the morning and 10 o'clock at night and have ideas. Emails were constantly back and forth, sending messages to one another, researching items that we could add to the proposal. It was a lot of work. It was fun work. It was hard work. But we came up with this very exciting proposal that the Harry and Jeanette Weinberg Foundation really liked. That's how it all began.
The TIPS program really evolved with a concept. My brother, who was a Pace University graduate, and they connected us with a professor named Dr. Jean Coppola, who was a professor working with college students who are primarily undergraduate, working with older adults at different locations. And over the course of a couple of weeks, we were very surprised to see not only the students, but also the seniors have that intergenerational component between the two.
Part of the TIPS program is working with students who travel to different sites and provide social support to the older adults there. This provides the intergenerational component of the program. It provides an educational opportunity to the students, and it also is a way of providing engagement at the site as well as reducing social isolation. We have students who have come to us and they're not quite sure where they're going to focus. But after the placement, at the end of it, they may say something like, I really enjoyed this and I can see myself working with this population in the future.
But their attitudes about aging and about older adults was significantly changed and improved with that contact. It is a great way to promote intergenerational understanding and activity.
And it wasn't just technology, but we saw a very human element of socialization. We asked the professor, hey, could these students, while they're teaching them how to use basic technologies, could they pilot out using our tablets and checking basic vital signs during a 1 hour fieldwork study type thing during the class? We taught them how to check blood pressure and things like that. So we said, you know what, we may be onto something here, working with collegiate students and working with older adults just to do basic wellness checks. The TIPS program is a very simple program where we find locations where primarily seniors congregate when they take their readings, such as blood pressure, blood oxygen, and weight. That is able to be transmitted into the web portal, where a telehealth nurse who is typically remote is able to review that data.
Hola, mi nombre es Sergia Cruz y vivo.
Westchester County is a diverse county, so we have students who speak Spanish, French, Italian, because the seniors feel very, very comfortable sometimes speaking in their own language.
I was introduced to John Migliaccio and also to Colette and May, again by Jean. So we met, and John, because of some prior work he had done, knew Michael Marcus at the Weinberg Foundation. And so we started conversations with Michael in fall of 2013, and it appeared that they were interested in funding our idea.
And then one day I got a call from Colette saying, John, we have this idea for this program. May has come up with this idea. We think it's a really good one. It was a back-and-envelope idea that has galactic capacity. She really saw something, as she has for decades here as the Commissioner on Aging in Westchester County. It's really her insight and her sensitivity and her response to the needs of the people that she's here to serve that really got this whole program started. So I happen to have a colleague and friend who worked for the Harry and Jeanette Weinberg Foundation, who among the largest funders internationally of aging services. I kind of pitched the idea to him a little bit, and he said, that has some possibilities. So we started to develop the proposal for that grant, and then found out in early 2014 that we had gotten a substantial multi-year grant. Then that was supplemented by money from Westchester County government.
I don't know what we would have done without Westchester County. There would be no TIPS without Westchester County. That support we got in terms of dollars and resources just could not be replaced. Westchester County was with us from the very beginning, and they're still with us after a decade.
One of the things that has been a challenge for us has been sustainability. So we're very grateful for all of the support we've gotten through grants, but it really is a challenge to have it work so that we don't have to rely on that, because every time a grant is finished, you got to go out and you got to go find another one. We think there is enough of an advantage and benefit from this program to organizations and companies that pay for health services to sponsor and pay for these services, because it's a bottom line advantage to them in the end.
Traditional healthcare up until that point was just when you feel sick, you go to the doctor. But we've always seen the program grow over the course of time, because they tell their neighbors and their peers that this is a benefit that could help them and there's no cost to them. Through the TIPS program, we check 3 different peripherals. It's a blood pressure, blood oxygen saturation, and weight. When we looked at how healthcare was delivered to our grandparents, this is something that we thought that could help society and could help them, prevent people from going to the emergency room, but also prevent people from needing assisted living, nursing homes, and others. Because with early detection and early knowledge, that gives the seniors empowerment how to make certain lifestyle changes.
We've won awards. We won, I think, 4 or 5 different awards, mostly innovation awards, because the model, number one, turned out to be so flexible, and 2, it was very, very effective.
To have a full tips session is all of about 6 minutes. So part of it is social. We get people out of their rooms or apartments. If you bring something to the place where people are likely to be found, it makes it a lot easier. And again, a lot of these people, they don't have a lot of easy transportation in their lives, and sometimes they're just getting around is hard. It's given us a chance to sort of build a whole health awareness industry around a relatively simple process. The equipment that we use is not that fancy. You could buy it all for a couple $100. What we found, which was really interesting, is that when you'd ask people on the intake form, who is your primary care physician, many of the people we talked to said, I don't have one. If I need a doctor, I go to the emergency room. Well, it turns out it's expensive to go to an emergency room. And if you're lucky enough to have insurance, you don't tend to think about that. But if you don't have insurance, you think about it a lot.
One of our awarenesses here at First Church is the fact that for our older adults, our senior community, they're going through a lot. And they're still trying to find purpose. They're struggling with the losses in their lives. One of the things that we found here at TIPS, even though they're coming for their vitals, they're getting a whole lot much more. They're finding community.
Before we had the TIPS telehealth program, we were guessing. However, when you include the TIPS telehealth program, where we're monitoring their blood pressure and their oxygen level and their weight, how many falls, how many hospitalizations, how many medication changes, when we have the statistics that we receive from the TIPS telehealth program, we can target what we need to present.
We were seeing overall 35% drops in hospitalizations and ER visits within 12 months of the initiation of the program. Everybody's got blood pressure issues. A lot of them have diabetes. A lot of them have heart conditions, some obesity. So what we're able to do is, in a very simple and easy way, give them health access that they would normally find. But if you look at who this serves, the top tiers of who benefits from this is not just the person who's getting the service, it's also their family. A woman who has to take care of an older adult, a parent, typically loses over $400,000 in benefits, from employment benefits, Social Security benefits, time off from work, leaving work early, over the course of caregiving to a parent. So this program has a tremendous return on investment for the cost. It's almost nothing in comparison to one ER visit bill. However, if you look at the kinds of conditions that are the most costly, some of these heart conditions, or congestive heart failure, or COPD, that we also tracked, we found reductions in hospitalizations and ER visits for those particular health conditions, somewhere in the area of 75 or 78%. So it makes no sense not to support it. If you can save money, right? Can you improve your own bottom line by spending $5 instead of $50,000 on something? Makes perfect sense. So if there's one thing that I would want, I would like to see legislation. I'd like to see ways to make this happen on a national basis, on an international basis. If you look at all the underserved people in underserved categories just for healthcare, simple things like getting your blood pressure, or getting a pulse ox, or getting your weight change looked at, and having some questions about how you're feeling and whether you've fallen and you're taking your medications the way you're supposed to, is simple enough to save, I don't know, trillions of dollars. Who knows?
The changes I've seen in the participants since they have been involved in the program is that they are checking in on themselves. They're checking their own vitals when they're here. They're following up with their doctors.
The lady that does the tips with us, she is so nice to us. As far as friends, we are one big family.
I believe to whom much is given, much is expected. If this program does not get the funding that it needs, shame on us.
Tips, it's worth being involved in that. It really is. And I'm glad I am.